Welcome to National News. I have with me Dr. Masood Ali Khan, a young, energetic doctor. From the day one of the COVID, he has been relentlessly, selflessly working with the patients of the Covid-19. And now there's a lockdown here, and I have come to speak to Dr. Masood. He is a specialist in internal medicine. He is the man who specializes from head to toe. So I have come here. Welcome to National News. What exactly is this COVID-19? There's a lot of fear psychosis, a lot of patients are getting admitted day by day, and even the pandemic is, getting, patients are getting increased day by day. Yes. So you being in this field as a specialist, what is your say on this?
Well, COVID-19 is nothing but infection of coronavirus. When you get infected with coronavirus, it is called COVID. That means coronavirus in disease from coronavirus. This disease is like any other viral disease, but the difference between any other disease and this is that it gets transmitted from one person to the other very rapidly, and it gets transmitted through droplets, and it happens so fast that the entire system gets overwhelmed. But this disease is something which we can control by taking precaution and there are certain key things which need to be done to control this disease.
Now, what exactly, because a lot of doctors are coming on YouTube, a lot of doctors are bringing out certain medicine and certain restriction, do this, do that. And what exactly is happening? Because you have been seeing the patients from day one, yes. You have been in the ICU, to meet me only, it took so long. So, what exactly it is? And this, what I mean, people, they're just coughing or getting light fever, they're all afraid. We have no beds, we have no oxygen cylinders, everywhere is full. So, what is your say on this?
See, very important thing is to understand the disease. This disease causes intense inflammation in the body. And through this, before it was thought it is respiratory disease, but it is actually disease that affects the entire body. So we need to understand that this is the disease if we take proper care and find out early about this disease, we can take good control and manage the disease very effectively. Luckily, we are at such a point in time that we know that some medications are of benefit in this disease. Like for example, dexamethasone, it is a steroid. It reduces the inflammation that is there in the body. So please don't get scared of this disease. If you have fever for more than 3 to 4 days, if you have cough, if you don't have loss of sense of smell or taste, don't panic and don't worry that they'll take you somewhere and put you in a government hospital or something. No. Today, if you are below 60 years and don't have any medical problems, you can stay below 50 years. You can stay at home and get treatment done. And there are certain precautions if you take early on, you will not progress to that kind of an illness. Today, the reason why everyone's getting worried is because people are getting breathless. They are waiting till they are breathless to come into the system or get the test done. We are seeing people who are breathless and short of oxygen who have not got the test done as yet. What I urge everyone is, if you have symptoms for more than 3 days, as a precaution, get yourself tested.
Some paracetamol they can start off with it.
They can start off regular paracetamol, morning, afternoon, night. But if the disease goes beyond 3 to 4 days,
or you can have augmentin.
Those all won't really help. But if you have persistent, you can speak to your doctor and get your test done, and we can start you on some medications now which will help you in this disease. See, there are blood thinner medications, there are steroids, there are some antiviral medications that are now in the market. One is Fabiflu, which is Glenmark medication, which is in my initial stages it is very helpful.
This some WhatsApp has come on, kit has come, COVID testing kit. So you do it yourself. So can anybody test himself as a COVID patient?
See, the antibody testing is there, which will in about 5 to 7 days you develop antibodies. You can test that, but that is the reliability of certain tests is less. But what we risk is that in that 1 week you may get the disease and you'll be transmitting to others. What I would request everyone, if you have fever or if you have cold or anyone in your family has cold, please, even inside the house, wear a mask, practice social distancing or physical distancing so that others in the family don't get. If everyone gets the disease, then nobody will be there to care for the person who is really sick.
There is a myth, that so many people are saying that World Health Organization said this is not a virus, it's just a bacterial infection on WhatsApp also has come. And why there are different statements every day? I mean, people are already afraid, they're panicking, and most of the patients which I have gone and seen as a journalist, I've seen that, he's got a headache and he suddenly gets a heart pain, and, his body, his BP comes down, his sugar level goes up. What is the reason for this? Do you think
Please don't look at your WhatsApp first of all. Look at your WhatsApp very judiciously. Don't believe every forward. It is a viral infection. We have enough and more proof of that. And virus from a family which is known to mankind for a long time. This is just a novel, new, once more strain of this coronavirus. It is not a bacterial infection. Plus, yes, if you delay it, you will get into trouble. Don't wait till your business. Make sure you get your test done. There are a lot of fever clinics by the government and in private. Go get your test done. That is, I would definitely urge everyone to do that. But don't panic. Don't panic, don't get scared. This is something which has 95% cure rate. Only 5% of the people get into trouble in ICU and can die.
So these medicines, there's people say drink with water, honey, have turmeric and have ginger with water. That all helps you to build your immunity. So ultimately, you need to say that social distancing is the main one of the reasons for you to tackle this. Now that there is a lockdown for till 23rd, how do you think would
the cases
will come down?
Yes, I definitely feel. See, I have no problem in anyone taking ginger. These are all good things. These are all what we have been doing since our grandmothers have been doing. No problem. Please take whatever you feel will improve your immunity, natural products. No, go ahead. But at the same time, most important thing is having good respiratory hygiene. That is wearing a barrier, that is a face mask. You don't need to wear N95 mask. Regular cloth-based mask at home will be fine. And the second thing is maintaining distance. He's my family, so it's okay. I can not maintain distance and not wear a mask. No. He's my friend. I can do that. No problem. He's my neighbor. No. Everyone. Ehtiyat is more important in this time. We have seen Makkah, Medina mosques being closed. That's a big thing for us. So, I would suggest that any place where congregation can happen should be avoided.
Coming to this very vital point, now that Bakrid festival is going to come, and sacrifice is there in Islam, it's wajib, and according to Sharia, we have to do it. You as a doctor, what do you feel, like giving the sacrifice? How do you maintain social distance? How do you give the sacrifice of the animal?
No, what I would suggest is this giving a sacrifice is between you and Allah. For this, I feel it was Allah has said, saving one man's life is like saving the entire mankind. That comes above everything else. If tomorrow, if I get money to go to Hajj, and if I give that money to someone who is in distress and save their life, Allah will compensate me for that Hajj.
And you get more.
Yes. So today, if you do with that intention and donate that money, Allah is Rabbul Alameen and He will understand your intention. If just imagine, if we have say 5,000 families give 5,000 rupees, 50,000 families give 5,000 rupees in Bangalore city, we can build nearly around 200 beds for people who are sick.
Mostly and can't afford.
Absolutely.
And how do
I think so. We should, as a Muslim community, we can. This is something which the spirit of sacrifice. We can show it. We can show how we can sacrifice, and this is the biggest sacrifice we can give. And I'm sure Allah will love this a lot.
how long do you think this pandemic will be there?
This is still going to go. Cases are definitely going to increase if we do not respect this disease and follow certain guidelines. And I feel by the end of the year also it will be there. It will be there like any other flu. Even after the medication is there, even after the vaccine comes, it will stay like how H1N1, that is the swine flu, is there. It will be there. It will be part of the spectrum of the disease that will be there, but not to the level of pandemic. So many cases are not there. It will remain, and hopefully we will have better medications. Hopefully our understanding of the disease will be better. We'll be able to manage it better.
Thanks for speaking. Dr. Masood was very clear on his thing, that saying that wearing a mask is very essential whether in the house, because this disease will be contagious. And he also was very forthcoming that the forthcoming festival of Bakrid, one should give sacrifice, is essential in Islam. But this money should be given to the poor, so that one life saved is equal to a mankind has been saved. And he also was stressing the fact that this money can be used to help the poor who can't afford the medicine during this pandemic. And he was also of the view that the pandemic is here to stay, and we have to take precautions and follow certain guidelines. Rizwan Asad, National News.